I would like to welcome you to the webinar today. And the digital transformation of care is our topic with Dr. Bonnie Clipper. I'm so excited to share that with you today.
Today, we're going to talk about the digital transformation of care. And what I want you to think about is how this is going to impact you in your role in your country, because it's a little bit different and nuanced globally. Let's start by providing some context. So, when you think about this from an environmental scanning perspective, think about the workforce and how it has changed over the last 3 and 4 years. It's absolutely impacting our ability to continue to deliver care. We've seen a shift in where care is provided. We are seeing a very rapid adoption of technology, and we're also seeing financial pressures that just aren't going away. They're only increasing. So, this term is perfect for where we are at this point in time in healthcare. VUCA. It was developed after the 9/11 attacks in the United States, and it stands for volatile, uncertain, complex, and ambiguous. And if you think about that definition, it is incredibly appropriate for what we're all experiencing in each of our countries in healthcare at this point in time. And we're really seeing that no matter where you step, there's a lot of uncertainty, and our footing isn't quite as stable and comfortable as it used to be. That's impacting us dramatically. Let's talk a little bit now about the workforce and what has been disrupted in that regard over the last several years. We are seeing new roles emerge, we're seeing new opportunities emerge. Who would have thought that Amazon would become one of the largest employers of advanced practice nurses? So we're seeing a lot of changes happen in terms of the roles that are out there and who is hiring them. Technology enhanced care is growing exponentially year over year. And we're even seeing education changes. There are some amazing new platforms and opportunities out there, even through providers such as Lecturio, that can really help us to solve to some of the challenges we have needing to develop the current and future workforce. Now, let's also talk about retention. Particularly as we focus on nurses, we really know that in the United States, there's about 5 million nurses, but globally, there's 30 million. We're seeing similar issues in terms of retention around the country. So, this is not just a US centric problem. We know in the United States that about a fifth of our nursing workforce is looking at leaving in the next 2 years. That's really the same globally. So, if you can imagine out of those 30 million nurses, if we lose 20% of that, that's an incredible impact that we're going to start to see to patient care around the world. Now, we see some good things happening. Certainly, when we look at turnover rates in the US, what we've seen is that they've begun to level out, and we'll pretty soon get a picture of how 25 is heading. What direction are we going? And what we've seen is that the 2 years of the pandemic, 2022 and 2023, turnover shot up dramatically. It's starting to come down. So we should know how this first quarter is faring, and hopefully we'll continue to bend the curve. And again, we're seeing some of this. This is US data, but from a global perspective, many of the trends continue to parallel. Now, this is fascinating. This is from the Bureau of Labor Statistics in the United States. And what we were trying to get a sense of is, what does the nursing workforce pipeline look like? How many nurses are we producing? And what does that, is it a decrease? Is it an increase? And you can see that there is a very incrementally positive increase in growth over time. So that's amazing. And we need that. Now, if you look at this next slide, you're also going to get a sense that we continue to see nurses leave. And what we're seeing is that the growth of that workforce is occurring in non-hospital settings. So what that means is that while we saw the workforce pipeline growing, they're going into jobs that are not associated with hospitals, but rather community-based, public health-based, looking at external emergency departments, urgent cares, clinics, ambulatory surgery centers, etc. Now, some of that's good because it's going to help support our communities, but some of it means there's going to be an impact on the hospital side. This is something that in the US we're grappling with in a different way. And in many other countries, there are more robust community health and public health processes and systems. So you can see this experience and you'll feel it in a little bit different way. Now, we still see that there is an awful lot of turnover that is occurring among our youngest nurses, particularly by year two. And again, this is a US based data point, but we know that about 60% of our new grads turn over by their second year. So, this is not only a tremendous opportunity for us to fix, it's also something that we have to think about and plan for, and it's part of the reason that we need to explore technology and digital health as a way to help us resolve our workforce challenges. Now, the reason that it's certainly important that we have our new nurses turning over is that that churn continually creates backfill with even younger, less experienced nurses. What we see when we have such a high number of younger, less experienced nurses practicing is that there's a gap that is created between the experience level of the nurses and the complexity of care of our patients and their families. And as you can see here, that gap continues to widen. The danger here is that that gap is where we have the bad outcomes, the medical errors, the unexpected and untoward events. That's the challenge that we see when we have a less experienced nursing workforce and the care complexity increases. So, this is something that we absolutely have to solve. It's going to be a combination of improving the education of nurses coming out of school and also enhancing the development and the professional development of not only nurses, but really even all disciplines that are working in our clinical professions. Now, it's not just clinicians that are experiencing this. In fact, we're seeing turnover increase among leaders. This is two different studies of nurse leaders. You can see there's a study that was conducted in 2021, and there is a study that was conducted in 2023. And what we see is that there's a lot of harmony in these two studies. The intent to leave within 5 years, when you look at the nurse executives responsible for the operations of nursing within a hospital, that's over 50%. And when you look at this on the right side, 29% of the sample intended to leave, and then they gave us more detail about why and what that looked like. 17% looking at a role change, 9% leaving nursing, 2% exiting healthcare altogether, 1% retiring. It's not uncommon when me and my team go into organizations, we talk to leaders privately, one on one, they let us know that they're planning a change in the next year. So, this is something that we're seeing certainly on a global level as well. I have the benefit to have done some work in Portugal and in Spain, and we hear these kind of things from our conversations over there. So, I think we have to find ways to make nursing more doable again so we can make these leaders successful and retain them. Now, we also know that we're seeing this not just in nursing, but in fact in other clinical disciplines. So you see that in 2021, this is a United States data point, but we saw over 300,000 providers exit the workforce in 2021. Now, that was in the middle of the pandemic, and that was an extremely difficult time, yet that's a very high number. And we also know that in the US, as of last year, the projection was around 124,000. We have not yet received the final number for 2024, but estimates are that it was absolutely going to be close to that. So when you think about the fact that the workforce continues to migrate out, how are we going to be able to increase the input into that pipeline? How are we going to be able to produce more clinicians? How are we going to be able to retain them and keep the ones that we have? So these are all things for you to consider as we think about this today. The business case from a nursing perspective, and I'm a nurse, so I'm biased on this, but from a nursing perspective in the United States, every time a nurse turns over, that's about $56,000. And that's including the cost of retraining a new person, extra hours to fill those shifts, recruitment, retention, orientation. That's an extremely high number. We also know that for hospitals that are understaffed, they lose about $90,000 a day. Sometimes it's because we can't admit patients or we can't do cases in the operating room. So we really do have to find ways to improve our turnover. This is also where technology is going to assist us. So I think there's a tremendous amount of potential here. Now, I want to give you a little bit of a sense of what do CEOs think about in terms of their top priorities, because you're going to see that all of these pieces blend together and they help us really build the case for adopting technology. Now, from a CEO perspective, this was conducted in January of 2023, and in fact, the results were very, very similar in 2020 or December 2023. The results were very similar in December of 2024. The three things that keep CEOs up at night, based on a survey from the American Hospital Association, are personnel shortages, financial challenges, and safety and quality. You can see how that really impacts and reaches across everything that we do in healthcare. So again, this starts to paint the picture that we need to think about how are we going to not only utilize this disrupted state of healthcare, but how are we going to begin to explore things in an innovative and different way than we have ever before? Now, I'm not endorsing any of these. These are just really some of the very innovative companies that are out there that are beginning to impact hospitals, healthcare, even nursing from the outside in. When you think about it, it's very difficult for us to change in healthcare, partially because we have a lot of traditions, partially because we have legacy systems, but it's also difficult for us to think about literally doing things differently. So sometimes disruption is coming from the outside. I don't think this is bad. I think it's actually quite good because it's going to challenge us to continually adopt technology and think about things differently.